Welcome to the presentation on exercise benefits. Now, if exercise were to be the form of a pill, it would be the most prescribed pill in the whole world. More importantly, it has a positive effect on all your modifiable risk factors to heart disease. Exercise is like a shotgun approach to all your risk factors to heart disease. So starting at the top there, physical inactivity is a known risk factor to heart disease. And of course, by exercising, you're wiping out that risk factor. Smoking, of course, is another risk factor to heart disease, and exercise plays an important role in helping you quit smoking. A regular exercise program, you basically have much higher quit smoking success rates. And if you are smoking, please try to quit. And you can see our presentation on quitting smoking. High blood pressure is another risk factor to heart disease. And when you commence an exercise program, your blood vessels do dilate, allowing the blood to flow much better, therefore reducing high blood pressure. Stress is another risk factor to heart disease, and exercise is an excellent coping strategy for stress. With exercise, you release these good chemicals called endorphins, and they actually help you combat stress. They help you reduce stress, tension, anxiety, and even depression. Overweight is another risk factor to heart disease, and with you exercising, you're increasing your caloric expenditure. This helps reduce body fat and help you reach a healthy body weight. This also increases the oxidization, or the breakdown and use of fats. Now, with high cholesterol, we have what they call the good, the bad, and the ugly, and that's what we talk about in our risk factors presentation. The good cholesterol increases with exercise as well, so you can improve that risk factor profile. If you have diabetes, it is also a risk factor to heart disease, and with exercise, you're able to control your blood sugars more easily. Decreasing the tendency of the blood to clot in the blood vessels is very important, and this is important because small clots traveling in the blood are often the cause of heart attacks and strokes. Now, with exercise, it has been shown that you can develop new blood vessels in the heart or even any other muscles. This allows for what we call a natural bypass to take place by increasing the development of smaller blood vessels, or what we call capillaries, to reach areas where it's not getting enough blood. Exercise enlarges the arteries that supply the blood to the heart. You also have better use of oxygen as your muscles undergo a training effect. You will increase your endurance. Exercise will also help you increase your energy levels so you can do more activities without becoming tired or short of breath. Exercise will also increase your aerobic capacity, or what we call your fitness level. This gives you the ability to go through each day with less relative energy expenditure. This enables a fit person to have more energy left at the end of the day and to get more accomplished during the day with less fatigue. With exercise, it'll also improve your circulation. And this happens by increasing the hemoglobin concentration in your blood. And hemoglobin is part of the red blood cells that carries oxygen from the lungs to the rest of the body. And this makes the heart more efficient at pumping, therefore increasing the amount it actually pumps, and that's the stroke volume. Now, with exercise, it'll improve your muscle tone and your strength, improve your balance and your joint flexibility, and also strengthen the bones. How it works is it increases the thickness of the cartilage in the joints, which then has a protective effect on all your joints. You will have increased muscle tissue, healthy bones, and flexible joints. With exercise, you will increase balance and coordination, which is especially important as we age. Your heart muscle is working all the time, so it needs a continuous supply of oxygen. This oxygen is provided by the coronary arteries, or the arteries in your heart, which carries blood and delivers oxygen to your heart muscle. When the heart muscle has to work harder, it needs more oxygen. Symptoms of angina occur when the coronary arteries are narrowed or blocked by hardening of the arteries or even by a blood clot. Now, if you're experiencing any forms of angina, please speak to your doctor. You should be medicated to treat your angina, and there are two types of angina that we discuss. Both forms can be relieved with medication. Of course, there's stable angina and unstable angina. An unstable angina is discomfort at rest or with very minimal activity. If you are experiencing unstable angina, this could mean exactly that. It is unstable, and therefore could obviously lead to a heart attack or even some type of acute coronary syndrome, what we call. Now, stable angina is angina that is predictable and present only during exertion or extreme emotional distress. It does go away with rest. Now, exercise helps you control your symptoms of angina. This does, of course, happen over time, and nothing happens overnight. And as you improve your exercise tolerance, you push your threshold for angina further out. Unstable angina is angina discomfort at rest or with very minimal activity. So it's very important that if you are experiencing unstable angina that you do talk to your doctor. Now, another good benefit of aerobic exercise is it does, of course, decrease the likelihood of getting a common cold or even a common infection. With exercise, it also decreases the likelihood of chronic diseases such as lung disease, kidney disease, mental disease, diabetes, and of course, cardiovascular disease. And with exercise, it will make you look and feel healthy. It will boost your self-image and self-esteem. With exercise, it increases the amount of blood that flows to the skin, making you look healthier and feel better. People will notice a difference. With exercise, it will also improve your sleep. You'll feel more relaxed and rested and therefore improves your sleep patterns. This allows for a better quality of sleep as well. And I think the best thing about exercise, even though you may have heart disease, studies show that you can improve your life expectancy and quality with exercise. The most important thing, in my opinion, is it allows you to live happier, healthier, and longer. It will improve your life expectancy and quality to the best.